The American healthcare system is a monopoly. The current conventional medical system in America has been the dominant force for the past 80 years or so. The governance of medical licenses and scope of practice are all dictated by the states. And there is major opposition from the conventional medical system anytime any state proposes any expansion for a scope for a medical practitioner that already exists, or licensure being established for an alternative practitioner. And that major opposition is really based on what they call scope creep, or these alternative practitioners are accused of not being evidence-based, or just some other disparaging comment. But if we're going to make decisions based off of evidence, let's take a look at the evidence. To start with, the conventional medical model has been the dominant force for the past 80 to 100 years. And since then, we have continually increased the rates of chronic disease, increased the rates of obesity, increased the cost of healthcare, and we have not increased life expectancy. In fact, in any developed country, we have the highest healthcare costs and the lowest life expectancy. And I certainly don't exclusively blame the conventional medical model, but it is incredibly clear that the conventional medical model is not the solution. And besides that, I mentioned that each state makes its own decisions on medical licensing and scope. So we have information from states that allow alternative practitioners and allow scope creep, which is actually just scope expansion to the extent of their education. And then we have other states that have not allowed this scope creep or licensing alternative practitioners. And there was a recent survey done that was asking conventional medical doctors which states are the best to practice in and which states are the worst to practice in. And it turns out that the 5 states that are the worst to practice in, have the highest rates of physician burnout, and the poorest health outcomes, are the states that have most successfully blocked alternative practitioners from scope expansion or establishing licensure. And the 5 best states to practice, with the lowest rates of physician burnout and the best health outcomes, are the states that are allowing this scope expansion and allowing alternative practitioners to be licensed. So right now, our dominant medical model is leading us to worse and worse health and is very actively blocking scope expansion and establishing licensure for alternative practitioners, even though the states that have adopted this have happier physicians and better health outcomes. So to anyone that is opposing alternative medicine in your state, what are you doing? Stop preventing people from trying to make this world a better place. And if you're accusing alternative practitioners of not being evidence-based, I suggest you take a long, hard look in the mirror.